and its impact on seniors. Here's an example of how they did it.
The greatest threat to Medicare is Obamacare, and we're going to stop it.
This is where seniors could find out their Medicare benefits have been rationed or don't cover their treatment. And this is where 15 unelected bureaucrats could decide to cut Medicare spending.
Obamacare side effects include job loss, higher premiums, higher costs, higher taxes, Medicare cuts, expansion of Medicaid, losing the plan you like, special backroom deals, small business penalties, denial of pre-existing conditions until 2014, even for kids.
Those were the campaign ads you saw a lot in 2010, rhetoric in 2012, and that's how Republicans and their allies say the law is bad for seniors, and frankly, a lot of seniors believe them. We see it in the polling. So today, a deep dive in what the Affordable Care Act really means for seniors, specifically those on Medicare. So let me show you. First and foremost, let's clear this up. If you have Medicare Insurance Part A or Medicare Advantage, that's enough to fulfill the individual insurance mandate. You do not have to enroll through the exchanges. There will be some changes to other Medicare plans. Let me explain. Medicare Part B, for example, under the health care law, prices for higher income seniors are going to rise. To this point, the income threshold for paying more was on a sliding scale and it rose every year. That doesn't happen anymore. It's frozen at $85,000 for individuals, $170,000 for couples. If you make more than that, you will be paying more. Now, the good news. Some preventative services will now be free, specifically annual wellness visits and some screenings like mammograms and colonoscopies. Moving to Medicare Part C, also known as Medicare Advantage. If you're under this plan, your coverage may change for better or for worse. First of all, Medicare is planning to pay less to some Advantage plans, meaning plans may cut benefits or raise deductibles to make up the difference. At the same time, though, the new law says your insurance company can get a bonus if it improves your Part C plan. We should mention also that healthcare providers will be subject to these new rules and payment rates, which could lead some doctors to decide not to participate. That is a fear among some. Possibly the biggest change, though, to the law is Medicare Part D. It's the prescription drug benefit. Before the law was passed, drug costs were paid through your insurance company and your deductible up to a limit. This year, the limit is $2,970. After that, seniors were solely responsible for costs until you reach the threshold for catastrophic coverage, around $4,700. In between is the so-called donut hole. Seniors had to pay for it on their own. Under the health care law, insurance companies now have to chip in about 50% for brand name drugs, less for generics. They'll pay more and more each year until the insurer's portion hits 75% in 2020. So not a full closing of the donut hole, but a big chunk of it. One last point. The government says concerns that the health care law will hurt Medicare are unfounded. And this is what they say will actually save money by cutting back on, you hear this phrase a lot, waste, fraud, and abuse, but that will also extend the program's life at least through 2029. And that, of course, has been backed up by CBO as far as that's concerned. You can go to our website to see all of this information as well as our reporting this week on how healthcare reform is impacting people of all ages. We've gone through various ways. This one today was focusing on seniors. We talked about young folks the first day, talked about folks in that tweener age between 50 and 64. Plus, we have a new story this morning with a look at how governors are distancing themselves in the midst of the shutdown, by the way. Check out our rundown.msnbc.com for a lot more.